Margarett, Minister of Health Promotion and Sport. We have our Chief of Staff, Jennifer Welshman. We have our Senior Communications Advisor, Rob Foote. And we have our Health Policy Advisor, Camille Gooden. And Zubair Patel from Office Management and Correspondence. Clarisse, is she here? Oh my. Strategic Policy Advisor, Clarisse Christie. We've also got our MHPS, Ministry of Health Promotion and Sport officials. We have Ann Haynes from our smoke-free unit, and Suzanne Gregor from Pan Am, and Rick Beaver from Sports and Recreation Programming. From our communications branch, we have Julie Rosenberg, Issues and Media Relations Management. So just to, again, welcome you to the ministry. Thank you for coming. This is National Non-Smoking Week, and yesterday, among other things, was Weedless Wednesday. And we would like to share what the ministry has been up to for the past year, but specifically with respect to issues pertaining to our various ethnic and diverse communities. So I'd like to welcome you again and ask the minister to say a few remarks.
Thank you very much, Wendy. It certainly is a great pleasure for me to welcome you here again to the Ministry of Health Promotion and Sport. I certainly am very cognizant of the important work that the ethnic media does in the communities across the province. Certainly, I know that many of you know and are aware that I am an immigrant and have lived in this country in the province of Ontario for 34 years. And during that time, I certainly have had the benefit of the ethnic media, and it certainly has kept me connected to my roots in various degrees and connected me to other communities as well. So I am delighted that you were all able to join us and to make time for us in your schedules to be here tonight. The Ministry of Health Promotion and Sport understands the challenges that Ontarians face in finding effective ways to promote healthy, active living in Ontario. The Ministry's strategies focus on nutrition, physical activity, sport and recreation, as well as smoking cessation and prevention. We are also working hard to address the risk factors associated with chronic disease and injury prevention. One of my ministry's key priorities is to continue working towards a smoke-free Ontario. This is particularly relevant this week because, as you have heard, this week is in fact National Non-Smoking Week. And just yesterday, as Wendy correctly pointed out, it was Weedless Wednesday, a day that people have for over 30 years, since 1977 in fact, reminded others about how important it is to quit smoking and to take up the challenge to quit on one day of Weedless Wednesday and to carry it on following week, Weedless Wednesday. It is a time to remind Ontarians that tobacco use is the #1 cause of preventable death and disease in Ontario, killing 13,000 Ontarians each year. Tobacco use also costs Ontario's healthcare system $1.93 billion in direct healthcare costs and $5.8 billion in productivity losses each year. And this is just, in terms of losses that I'm talking about here, not related to the human component of losses in terms of time with family. And that is why yesterday on Weedless Wednesday, I joined with some of our key partners in the fight against harmful tobacco use to make an announcement that we will help up to 20,000 more smokers to quit smoking. The initiative announced will also help to reduce health care costs due to tobacco-related illnesses. Together with partners, we are educating Ontarians and empowering them to make good choices about their health, better choices. And we are trying to get the message out trying to get people to respond to the message that nicotine is not a lifestyle choice. It is in fact an addiction. And it is indeed one of the toughest addictions to break, and we recognize that. In fact, nicotine addictions have been compared to heroin and cocaine addictions. Users rarely quit on the first try. Users need support, resources, and encouragement. And that is why the McGuinty government is committed to helping smokers to quit smoking. Additionally, health professionals have always played a valuable role in helping smokers to quit. Yesterday's announcement builds on our ongoing support for health professionals in these efforts. With this announcement, we invited family health teams to indicate their interest in participating in this initiative. For the family health teams that do participate, they will have access at no additional cost to them, nicotine replacement therapy, such as the nicotine patch or gum, as well as smoking cessation training and coaching support for their health professionals. With these resources, the teams will be able to provide even more assistance to patients who want to quit smoking. This also means that the medication and counseling will be at no cost to the smoker. We expect this initiative to be in place later this spring. We will continue to build on initiatives with partners like the Center for Addiction and Mental Health, the Heart and Stroke Foundation, and the Canadian Cancer Society, the Ottawa Heart Health Institute, and Public Health to help people to quit smoking. With programs such as the Smokers Helpline, operated by the Canadian Cancer Society, the STOP program at the Center for Addiction and Mental Health, which has helped more than 60,000 smokers by providing free nicotine replacement therapy and counseling. Leave the Pack Behind, a program designed for young adults to reduce tobacco use and support healthy lifestyles on Ontario post-secondary campuses. And since 2006, the always popular initiative, Driven to Quit Challenge from the Canadian Cancer Society, which has helped more than 130,000 Ontarians in their attempts to quit smoking. The contest for this year launched on January 4th and registration closes on February 28th. And for those of you who are smokers in the room, and we hope that there are not many of you, but we recognize that smoking is addiction, and here's an opportunity again for you to get some help and even win a car while you're at it in this contest. People can learn more by going to the website www.driventoquit.ca. I strongly encourage you to let your communities know about this important initiative and our other programs as well. And although we are here today during National Non-Smoking Week, I would be remiss if I did not reference other key priorities for the Ministry of Health, Promotion and Sport, and indeed the Ontario government. Getting Ontarians to make healthy eating choices and to get active. Certainly of concern to us is the state of our children's health. More than 50% of Ontarians are at an unhealthy weight, and only 14% of Ontario's children and youth achieve recommended levels of physical activity. We know that active children with healthy eating habits have a better chance of growing into healthy adults with less chance of developing a variety of health problems like diabetes and heart disease. And that is why we recently launched a Healthy Living initiative to help parents who want to make changes to their families' eating habits or become more physically active. To get more information on our efforts, I encourage you to visit our website at ontario.ca/healthy for tips, expert advice, and other useful information. We have a resource called Eat Right Ontario, which was initially long.